practice. Supplements no doubt are essential for hair growth and healthy glowing skin. Nonetheless, one should not forget that oversupplementation is dangerous and therefore expert advice is required. Dietitians here play a multidisciplinary role in hair loss as well as skin treatments by assessing the nutritional deficiencies and working with patients to eliminate dietary gaps that may affect their hair and skin also. Developing a broader understanding of the client's eating history is essential as a sudden change in the dietary pattern, example, a client becoming vegan, can trigger hair loss. Research shows that inadequate consumption of overall calories or protein or micronutrients leads to limited hair growth and noticeable cutaneous dysfunctioning. We may need to closely work with the dermatologist or the trichologist to determine the best course of action for our patient and ensure continuity of care across specialties. Dietary changes or modifications might help to prevent recurrences of many diseases, thereby minimizing secondary hair and skin problems. We are going to look at all these different aspects of beauty from the respective experts in the field today. We dietitians, I believe, are in a unique position to help consumers not just to stay healthy as a result of their dietary choices, but also look their best as well. Here I'd like to share a little tip which I tell all my patients that they must repeat every day, in every way. I am getting better and better. With this, let me welcome our Mumbai chapter convener, Ms. Zamrud Patel. Ms. Zamrud Patel is no doubt the convener of Mumbai chapter Indian Dietetic Association. She is also the chief dietitian with Global Hospitals. She is she has done a lot of work in the renal field and has done chronic kidney and has done publications in chronic kidney diseases, diet in chronic renal failure, and healthy delights. She is also been a guide and co-guide for many postgraduate students at the SVT College Mumbai, and she gives lectures at various national conferences and seminars. We welcome Ms. Zamrud Patel.
Thank you, Rashida, for those kind words. Friends, it's an honor to welcome all of you today on behalf of Indian Dietetic Association Mumbai chapter to this concept which our team has put up. The lead is Miss Rashika and Miss Neeti to think different and to think of this aspect of beauty. So I think it's going to be a learning experience for all of us, a very beautiful learning experience, I would say, for all of us, because they have brought the best speakers today for us who will be guiding us, which will not only help us professionally, but also personally. So I would want to welcome all our dignitaries today. We have Dr. Vibha Murad, Dr. Samara Reyes, Dr. Krupali Parikh, Miss Ruchi Gupta, Miss Sumita Gage, and our very dear own Rashika. For the moderation, we are privileged today to have our national president with us, Jagmeet Madan ma'am. So along with Neeti. So I really feel that this session is really going to help all of us, and definitely this concept is really different. I congratulate the full team on thinking differently and providing information which is evidence based, which will not only help us grow professionally but also personally. So thank you, and I welcome all of you today. So let's have a learning treat today. Thank you, and over to you, Rashida.
Thank you so much, ma'am, for these kind words. We now begin with our first talk. Our first speaker is Dr. Vibha Murad. She is a consultant dermatologist, founder of the Believe Health and Skin Clinic in South Mumbai. She has worked for the UR Skin Clinic very closely with late Dr. Rekha Seth and has been presented an award-winning paper on facial melanosis and hyperandrogenism at the Cosmetic Dermatology Society of India. Welcome, Dr. Vibha.
Hello everyone, I'm Dr. Vibha Murad, founder of the Believe Health and Skin Clinic in Mumbai. I am a practicing dermatologist and I also specialize in aesthetic dermatology. Today, I'm going to talk to you all about lustrous locks, that is, good hair. Today, all of us want to have good hair. In fact, this is one of the commonest complaints we face from patients in our OPDs on a daily basis. People have a lot of hair fall, a lot of stress related disorders, genetic issues, diet problems, which lead to hair fall. Let us see how we can preserve and nurture these lustrous locks of ours. I'm going to talk about the problems faced, the hair cycle in general, the general hair care, nutritional requirements, today's issues, hair treatments, and the conclusion. Hair is the first to get affected. Hair cells are the second fastest growing cells in our body, second to the intestinal cells. We have around 1,20,000 hair on our scalp, all of which need nourishment in order to grow. But hair being a non vital tissue in our the body never prioritizes its nutritional needs. So, due to the hair's expendable nature, a nutritional imbalance, the slightest nutritional imbalance, will often show up in the form of hair loss. Thus, we need to take care of any sort of imbalance which happens in the body. Coming to the hair cycle is divided into three parts: the anagen phase, which is the growth phase of the hair, the catagen phase, and the telogen phase, which is also called as the shedding phase. The anagen phase is specific for each area hair of our body. For example, the anagen phase of the hair on our head is around, say, 2 to 6 years. In the anagen phase of the hair on our, say, hands or on our eyebrows is around, say, 1 month. That's why the hair is limited to a particular length. Then comes the catagen phase. So the catagen phase is like the phase where the hair rests. This is the phase where the hair stops growing and it is just in a phase of dormancy. Slow detachment of the hair shaft from the hair root, hair bulb occurs at this point. The last is the telogen phase where the hair is shed and then the dermal papilla leads to a new hair follicle growth and thus the cycle continues. Physiological shedding is temporary, which happens during the telogen phase. It can occur during the anagen phase, that is, the growth phase can get restricted due to, say, alopecia areata, or if there is drug induced hair loss, entire strands of hair start falling together in clumps. Telogen effluvium usually occurs 2 to 3 months after a provoking event like parturition, sudden weight loss, blood loss, fever, or stress. The shedding stops within a few months, but it takes a couple of months for the bulk of hair to come back to normal. Chronic telogen effluvium arises when the hair cycle speeds up so that the anagen phase is shorter. So the anagen phase, which we mentioned earlier, of 2 to 6 years, becomes much shorter and the hair is put into the telogen phase. And here you need to identify and treat the cause. Otherwise, this phase continues for very long, leading to massive hair loss. Example, iron deficiency anemia and hypothyroidism lead to such kind of hair loss. We encounter a lot of problems like, I'm so and so 21-year-old. We get patients right from the age of 5 6 year olds to 65 70-year-old patients who come complaining of hair fall, due to which there is loss of self-esteem, loss of confidence. People don't wish to go back. How can we get our hair back is one of the commonest problems faced. While talking about this, let's talk about the triggers of hair fall. Various factors like hair fall is a multifactorial issue. Stress causes a lot of hair fall to happen, genetic, anemia, PCOD, and hypothyroidism all cause hair fall. Coming to the do's and don'ts of healthy hair care. How do we maintain a healthy crowning glory? We need to massage our scalp daily. Even for a couple of minutes is good enough to improve blood circulation to the hair. Hair should always be rinsed with cool water. Very hot water strips off the excess moisture from your scalp. Our scalp needs to be washed because all the oily residue, the dust, the grime collects on the hair. We do not need to wash our hair, the strands, so well and make them dry. The hair should be washed with a moisturizing shampoo after swimming. In general, when we are washing our hair with a particular shampoo, the frequency should be altered. That is, if we have very oily hair, we should wash our hair more often. If we have dry hair, we should wash our hair less often. But we should not use very harsh products thinking that that will clean our hair. We need to blot our hair and not rub dry our hair using of thin microfiber towels, or even an old t-shirt, old soft cloth really helps to dry our hair well. Thick Turkish towels really can cause damage to the scalp. Conditioning products should be applied to the hair strands and not to the scalp. The hair shouldn't be rinsed with very hot water, as I said before. Tight hairstyles should be avoided, but at the same time, we should remember if we need to leave our hair open for long periods of time, we should wear a hairband so that there is no too much frizziness that occurs on the crown area. Hair shouldn't be brushed or styled when it is soaking wet, and heat styling products should be avoided. If we need to style our hair for a particular occasion or an event, we should be sure to use a heat protectant spray before we blow dry or iron our hair. After having said all this, these factors of genetic, uh, general factors, the main underlying factor for us today for hair is nutrition. How diet affects our hair health. Diet is very important when it comes to hair growth because deficiencies as well as excesses can result in hair loss. We often see hair loss caused by iron deficiency anemia, and excess of vitamin A, that is hypervitaminosis A, can also lead to hair shedding. While coming to diet, of course, this is a topic which is way more better known to all of you all than to we dermatologists here. But we'll just cover it up in like really fast. So very few calories. So calorific deficit, little protein, vitamin deficiencies, low iron levels, uh, loss of biotin or deficiency of biotin, and zinc deficiency can lead to hair loss. What are the nutritional requirements for good hair? We need to pump up the proteins, take care of the carbohydrates, zinc, iron, vital vitamin C, omega, and supplements, of course. Coming to the protein bit, I'll just brush through this. So we know hair is primarily made up of protein. So diets with inadequate protein can lead to weak, brittle hair and loss of hair color and loss of hair itself. Carbohydrates provides energy. Complex carbohydrates, that is whole grains, fruits, they are better than simple carbohydrates like cakes, pastries, etc., as they give you a slow and sustained release of energy. Whole grain, toasts, peas, potatoes are all good sources of carbohydrates. Zinc deficiency can cause hair to shed. A multivitamin or a zinc supplement can enhance our zinc requirements as and when necessary. Less iron leads to excessive hair shedding. Iron produces red blood cells which carry oxygen to all our tissues and organs, including the hair follicles. Whenever there is a deficiency of iron, the red blood cells decrease, hemoglobin decreases, so the oxygen is reached to the vital organs and our hair doesn't get the required oxygen, which leads to shedding of hair. A large proportion of patients in our OPD who come for hair fall do have some degree of anemia. Coming to vital vitamin C is one vital nutritional requirement in our body which is neither made nor stored in our body. Thus, a regular daily supplement of vitamin C, either in terms of fresh fruits, fresh vegetables, or a pill, is often required to get good vitamin C. Vitamin C also helps in iron absorption. So vitamin C and iron go hand in hand, and this leads to increase in iron stores also. Deficiency of vitamin C occurs due to diet, smoking, alcohol, chronic illnesses, and eating disorders. Omega directly doesn't affect hair growth, but it stimulates hair follicles and sebaceous glands. It also improves scalp health, so in general, giving you a better yield of hair. Supplements, wherein we keep saying a well balanced diet is important, but these days, because of stressful lifestyles and hectic day to day responsibilities, it is very difficult for a lot of people to eat a nutritional balanced diet all the time. This is where the supplements come in. Hair grows only for around half an inch per month, even with everything that we do. So it takes around 2 months for supplements to have a visible beneficial effect. Within 12 weeks, we should see a definite benefit to the hair. The best supplements for healthy hair are calcium, biotin, iron, vitamin D, B12, zinc, and calcium pantothenate. These are a few good food items which help us in getting healthy long hair. A few nutritional do's for our hair. We need to always eat breakfast. Healthy breakfast is the key because as we wake up in the morning, our energy stores are less. So, energy to the hair follicles to grow is also less. So, a good nutritious breakfast may be a combination of a protein with a complex carbohydrate like a chicken sandwich or a paneer sandwich or eggs with bread is very healthy for our hair too. Hydrate as well as we need water for our skin and other immune functions. Water is a must for our hair too. Snack healthily every 4 hourly. They say our energy stores decline, thereby energy to the hair follicles also decline. So eating a sensible snack every 4 hourly is a must. We cannot talk enough about protein. Iron with vitamin C is also required. Black tea should be avoided because black tea, the tannins available in the tea bind to the iron stores, depleting the iron stores. Thereby, just a splash of, say, skim milk in your black tea would neutralize the effect. Be wary of dairy. So, as much as I'd say about milk and milk products which are good for the hair, there are certain people with eczemas and asthmas who get a bad flare with dairy. Those should find alternative sources of protein and avoid the dairy. And a varied diet. So, by eating different fruits and vegetables, we complete our plate of all our different vitamins and minerals which we need for our hair growth. These are just a few medical and dietary history risk factors that cause nutritional deficiencies which lead to hair fall. While we look at this, it is just a record that as we assess any new patients, even as doctors or as nutritionists, a complete history is a must so that any sort of deficiency can be supplemented for the patient. Today's issues, we get a lot of patients who have been on keto diet. So this is because the diet is low in carbohydrates, which leads to resulting hair fall. There is no problem about this. We can definitely supplement protein, supplement some supplements to the patient, which counteracts this hair fall. Intermittent fasting, this kind of diet also leads to hair fall because of a calorific deficit. So if that again is taken care of by giving them adequate proteins or some supplements, that can be taken care of. And another burning issue of today's day is the COVID-19. So this is a viral infection which is associated with a lot of stress, which leads to way more hair fall than other viral infections are doing. In fact, it is one of the biggest cause of agony in patients in the US, because there's so many patients and so many patients coming with tons and tons of hair fall post COVID-19. For this, we need a healthy, well balanced diet, supplements, other healthy lifestyle habits such as regular exercise, proper sleep, and stress management can help us with this COVID-19 hair loss. Coming to the hair treatments for regaining the hair that we have on our scalp and to make the existing hair thicker, various applications like minoxidil can be used. These days, even a lot of new peptides are available in the market. These help in reactivating and regenerating our hair follicles, leading to good hair. A lot of supplements, as I mentioned before, biotin, calcium pantothenate, B12, D3 are all required for hair. Various treatments are done in all our clinics these days. So we do the low level light therapy, that is the hair helmet, which helps to improve blood circulation. The micro needling procedure, which is done in which a derma roller is rolled on the scalp with serums, which are rich in growth factors and biotin and amino acids, which are specific to the hair, which cause like micro channels to the hair, leading to improved circulation and improved hair growth. Platelet-rich plasma is also a very effective treatment to counteract hair fall and to make our existing hair better. So in conclusion, we would say use chemical-free products created for the individual hair type. We need to eat right. We need to avoid heat styling, and following all the above tips, we can bid bad hair days a goodbye. But most importantly, if over and above all this we are experiencing excessive hair loss despite following a good hair care routine, we must consult our doctor before it is too late. In conclusion, I would love to say to love one's hair is to love yourself on all levels. As I started my presentation while saying that hair is a multifactorial entity in our body. A lot of factors play a role in giving us good hair. So, indeed, it's to love yourself on all levels. And I will say, however you may look, however may our hair look, however we are, don't always forget to celebrate yourself. Thank you.
Thank you, Dr. Vibha. That was indeed a wonderful session on hair. And I'm sure we're going to get a lot of questions. We request all participants to put in their questions in the chat box. We'll be taking the question answer session in the end. All the lovely speakers are going to be with us live during the question and answer session. So all of them all of us who have queries can put in their questions there. We now move on to our next presentation by Dr. Samara Reyes. She is DNB and founder of the Medical Head at Derma Hub. She is the clinical and cosmetic dermatologist. She has done fellowship in laser and dermatosurgery from Singapore, and she has authored chapters in Indian textbooks on dermatology and cosmetology and spoken at several conferences. We welcome Dr. Samara Reyes.
Hello everyone, I'm Dr. Samara Reyes. I'm a clinical and aesthetic dermatologist and I specialize in lasers and dermatosurgery. I've always been a diet fanatic, trying to drop the fat and gain the muscle, and have tried several diets all my life. So it's a pleasure to be talking here today. But however, as promised, I'm not going to touch upon food and skincare. Of course, I'm open to questions if any of you would like to discuss any of this. And I'm, of course, looking forward to take home some points from all of you today. So the topic for today is beauty skin deep. Now, I have always been a very strong advocate of the fact that beauty is not skin deep, and I have grown to believe in this much more with each passing year. As nutritionists, I'm sure most of you would agree that a good healthy diet is like a building block, whether it's your skin, it's your hair, or it's anti-aging. Having worked in Kokila Binavani Hospital as a full-time consultant for several years, I have actually had the privilege of having a multidisciplinary approach for most of my dermatology patients. So whether it was tackling acne and hair fall, pigmentation issues for the PCO patient, it was always in conjunction with the endocrinologist and the gynecologist and the nutritionists. Or whether it was atopic dermatitis and handling the skin eczemas, we always coordinated with pulmonologists for titrating the antihistaminic doses. Not just medical diseases and skin, but even your lifestyle matters. So this is somebody who smokes a lot. Smoking accelerates skin aging. So somebody who's 30 is probably going to look like 40 or 50 if they've been smoking heavily over the last decade or so. Sleep is another factor. So if you do not sleep well, it's like an oxidative stress to the body and your skin ages faster. Even the more superficial concepts of beauty like lack of glow, pigmentation, anti-aging, also I believe are not skin deep. Because the very first step towards taking care of your skin, taking care of yourself, or self-care is actually really motivation. It's about committing to a self-care routine or a skincare routine. It's about showing up, even if it's for 5 minutes every single day, to take care of your skin. And that, I think, is the biggest challenge for most women and even men that I see in my practice, and not getting a prescription from a dermatologist. I'm sure most of you here are juggling several roles. It's your kids, your house, cooking, your professional careers. So by the end of the day, you're not left with much time for yourself. And especially women, I think, always have this thing of putting everybody else's needs before theirs, having left not much time for themselves. My question is, no matter how busy you are, is it not possible to get 5 minutes out for yourself? That brings us to the next question, next point. It is about committing to 5 minutes every single day, which brings us to, it's more about discipline and perseverance, and who knows this better than nutritionists. It can sometimes be as hard as following a diet plan or following an exercise routine. So yes, I think even if it's committing to skincare and beauty, it's actually more a state of your mind. And if you're on the same page, and if you are motivated enough to dedicate 5 minutes of your time to skincare, I can help you with a few skincare tips to take home today. And I'll try to keep it as simple and general that most of you can incorporate in your daily routine. Let me discuss a few commonly asked questions, which brings us to the first question, which I'm always asked is, Doctor, what about cleansing, toning routine? Cleansing, toning, moisturizing routine. Now, this is my personal opinion, and I feel that you need to cater to a specific need for every skin type. And cleansing, toning, moisturizing may not be the need for your skin. Like we just discussed, not everybody has the time for an elaborate skin routine. So it's more important that you address the needs of your skin rather than just a general CTM routine. So that brings us to the question, what exactly is the need of a common Indian skin type? Now, Indian skin or Asian skin is popularly known as skin of color, which means we have high melanin in the skin, which is a double-edged sword, because if we have more melanin, we are better protected from skin cancers, which is good. But it also makes our skin very prone to pigmentation issues, be it inflammation, pimples, rashes, even dry skin. We immediately get darkening. So what are the skin lightening creams that you can use? In my opinion, for Indian skin, it would be better to have a lightening cream, a sunscreen, and an anti-aging cream rather than a CTM routine, which would probably be a basic skincare program, and to keep it as minimum as possible. So the lightening creams that you can use in your routine, which are safe, are vitamin C based, kojic acid, or butane azelaic acid. These are easily available in various combinations in over-the-counter drugs, and they're very safe. So even if you've been using it for a while, you're not likely to land up with any kind of side effects, and even if you're not being supervised by a dermatologist. I would advise to stay away from hydroquinone and steroid-based creams, especially if you're not in the supervision of a dermatologist, because here you might land up in trouble as you would not know when to stop using them. Of course, pigmentation is a common sign of sun damage. So there's also something we call cumulative sun damage. So over the last, say, 20 and 30 years, there's always been a chronic sun exposure, which makes our skin tone uneven, or brings about a few patches of pigmentation. This is what I tell my patients, that yes, you can use a lightening cream to address these issues, but more important than the lightening cream is your sunscreen. If you're going to step out for 15 minutes without sunscreen, you're going to darken, and it's going to take us as dermatologists about 2 or 3 months to lighten that. It's okay to forget your lightening cream once in a while, but it's important that you don't skip your sunscreen. So what exactly is adequate sun protection? Which kind of sunscreen to use? Most people always feel that they are well sun protected and they have been using their sunscreen ideally, which is far from the truth, because most people will just take a bit, dab it on, and step out, and probably that's it for the entire day. To be ideally protected by sunscreen, it is important that you put it half an hour before you step out. Most sunscreens in the market are going to be a combination of chemical and physical sunblock. Physical sunblock is stuff like zinc oxide and titanium oxide, which gives a white film, so it may not be very preferred aesthetically, and that's why most sunscreens will combine a chemical sunblock, which needs to be applied half an hour before you step out so that it starts acting and it protects you. Number two, you have to reapply your sunscreen every 3 hours, because it protects you only for 3 hours. The SPF is important, which means 30 plus, whether it's 30 or 50 works, but what's more important is to reapply it every 3 hours. So say by Indian weather, around the year mostly, you need to reapply at 8 o'clock, 11 o'clock and 2 o'clock so that you're protected through the day. What type of sunscreen to use? It will depend on your skin type, and Indian pharmaceutical companies today have so many cosmeceutical divisions that we're spoiled for choices. If you have dry skin or slightly mature skin, go for a moisturizing sunscreen or cream-based sunscreen, which will also hydrate as you use it. You also have certain argan oil-based sunscreens. If you have pigmentation issues, you actually have some brands which even give you lightening creams along with sunscreens, so you're actually using one cream instead of two. If you have very oily skin, go for a gel cream or an aqua or a water-based sunscreen. Face washes is again a very common question that I'm usually asked. What kind of face wash to use and how often? Please do not overwash your face. 2 or 3 times a day is enough. If you wash more excessively, it dries up your skin. If you're somebody who has a dry skin type, please make sure you use a moisturizer after every face wash. If you have acne prone skin, you can use a salicylic acid based face wash. If you have dry skin, use gentle cleansers which are usually soap free. And if you have a slightly oily skin, you do have oil control moisturizers, but mostly in such cases, there may be an acne issue. So if you start using acne creams, your oil automatically tends to come down. This brings us to anti-aging creams. What is a good age to start anti-aging creams? I would say anytime after 25 or even 30. If you want to keep it simple, just use one by the night. The most popular anti-aging molecules are retinol and hyaluronic acid. Hyaluronic, and you have a lot of combinations available. Please make sure retinol is only always used by the night. Hyaluronic helps to plump up your skin and helps to camouflage fine lines, which is a good molecule to use again. One very important point to remember, whether it's your lightening creams or it's your anti-aging cream, is that you must wait for your skin to dry up. So if you have washed your face, wait for half an hour, let it dry up, and then apply it. The reason being, if you put it on wet skin, it gets absorbed really fast and has a very high irritancy potential. The only cream that you can afford or you can use on wet skin is moisturizers, because when applied on damp skin, they hydrate better. A few winter care tips before we wind up, since the winters are here. If you have a dry skin type, use your moisturizer at least 3 to 4 times. What you can do is, again, a common misconception people have is water tends to hydrate your skin. So especially in the winters, keep your baths short, 5 minutes, lukewarm water. The longer the bath, the hotter the water, the drier your skin will get. Make sure you moisturize right after your bath. You can also use shower creams, which are preferred to soaps or shower gels, because shower creams hydrate. So it's like one layer of moisturizing as you're bathing. I feel that as medical healthcare professionals, doctors, or somebody from any field where you need to interact with people, it is really important that you take care of yourself, because it kind of reflects a certain kind of confidence and authority, where it makes people believe that you can help them or take care of them. So yes, I would like to end this from where we started by reinforcing the point that beauty is not skin deep. It is just not about your medical issues or your lifestyle or your nutrition or your sleep habits, but to a very great extent, it's also about your state of mind and your commitment towards self-care, which is going to determine what your skin is going to look like 5 years from today. So it is really a holistic approach, which is the essence of healthy skin that is beautiful from inside out. Good day, everyone.
After the excellent talk by Dr. Samara Reyes, we are going to have our very own Rashika Chunawala for the next session. It is indeed my pleasure and privilege to welcome dear friend and colleague Rashika, who is the chief dietitian at Beach Candy Hospital. She has a whopping 25 years of experience at this one of the premium hospitals in Mumbai. Rashika has her postgraduate diploma in dietetics and an MBA in marketing from University of Mumbai. She is, of course, the member of the local executive committee of the IDA Mumbai chapter and also an RD trainer. She's been a consultant to organizations such as Hindustan Unilever and NSCI, and of course has conducted various health and nutrition workshops at different occasions. So very warm welcome, Rashika. Over to you.
Thank you, Niti, for those lovely words. So let me take you all back to your bachpan. We all know ABCD, but today I have formulated an ABCD which is a little different. And I'm sure all we nutritionists are going to love it. So along with me, you all can also remember this ABCD. These are foods which will help us glow better. So starting with the ABCD. A is for aloe vera. Everybody knows the benefits of aloe vera. It helps us moisturize, it is anti-inflammatory, it helps wounds and injuries, it helps produce and release collagen, which makes your skin more supple, and it has also an antioxidant effect and can help repair sun damage. Befriend your berries as they are rich in antioxidant and they have ellagic acid, which helps decrease wrinkles. They are a good source of vitamin C. It helps fight inflammation. And of course, they're very low in calories. Calming chamomile. This is used generally to treat mild skin irritations, including sunburn, rashes, and even sore eye inflammations. It helps you calm your nerves and reduce anxiety and induce sleep. Who doesn't know the benefits of dark chocolate? It shields against UV damage, provides nourishment, and in fact, the flavonoids which are present in dark chocolate and they help you decrease the UV radiation. Yeah. So it flushes off dead skin cells and provides nourishment. And dark chocolate, of course, enhances mood. Everybody nowadays has heard about your chocolate facials and your chocolate waxing, and it's used abundantly in the beauty industry. Coming to the next alphabet, that is E, essential fatty acid. It increases the short chain fatty acid production, decreases breakout, enhances skin resilience to UV light, and provides a calming effect. E also stands for exercise. Exercise helps your skin look fresher and gives it a healthy, rosy glow. It is also addictive and is a mood enhancer. It is also generally vital for us to do exercise as it helps you groom well and give toning to your muscles. The alphabet F stands for fruits, facials, and fuller's earth. Fruits, the benefits of fruits when we eat is known to all in this community, but fruits are also used as a good moisturizer to brighten skin tone and improve skin texture. Facials nowadays are very common. They help you to exfoliate and bring out the layer of the inner layer of the skin, which is shiny and bright. And facials need not be done with expensive products. They can just be done with your kitchen ingredients also. The age-old use of one second, please. The age-old use of multani matti is well known to all. Fuller's earth is full of chemicals such as iron, magnesium, and silica. It helps you fight acne and pimples. At some time or the other, we all must have definitely used this. It is a cooling agent and also gives even skin complexion. The benefits of green tea in weight loss is commonly known to all, and it also helps in treating skin sunburn. It maintains the skin pH level, reduces the pore size, helps in decreasing dark circles. The epigalactocatechin 3 gallate helps in decreasing cell damage. Get going. G also stands for get going. Here in get going, it is essential that now we are staying in a virtual world. So what happens is we tend to be having a very sedentary lifestyle. The only request every day is now you have to get up and get going so that you are able to maintain a healthier you. Happiness is a state of mind. Indulging in hobbies which an individual likes is known to bring out a very different feeling of happiness from oneself, and it is visible on the face and mood. Therefore, one can indulge in whatever they like, such as uh, singing or doing an painting or maybe knitting or cooking or do things which make you happy. So happiness is really important in one's life. Ice, the very simple water ice, increases your blood circulation and it has marvelous effects on skin. It helps prevent acne, it does blemish control, it reduces puffy eyes, cleans the pores, and tightens skin. Jogging helps you decrease stress, fights against cortisol, flushes out toxins, it's anti-aging and improves sleep. Your K stands for kiwi. Kiwi, as we all know, is an excellent source of vitamin C and E. It delays aging and controls the appearance of dark circles. Keratin is another protein structure which is very, very essential in hair and skin. It generally provides youthfulness and hair elasticity and gets the skin firmly together and helps prevent sagging of skin. Lycopene. This is one of the favorites of all dietitians. The compound which is found in tomatoes has an anti-inflammatory effect and it's a powerful antioxidant. It prevents you against sun damage and excessive pigmentation and it is sensitive skin friendly. Also, here I'd like to mention that the alphabet L stands for love yourself. You are a very special being and no one else can be you. So before loving others, you need to love yourself. And like Karina from Jab We Met, become favorite of yourself. The alphabet M brings us music, meditation, and of course the protein-rich milk. Music is always a mood elevator. Music has been going on since years together, whether it is the classical music or the jazz music or the disco music or whatever. Music in any form is generally said to be a very calming, soothing mood enhancer. Apart from that, milk is a high protein food, which of course the benefits of milk and yogurt is known to all. But it helps in keeping your gut healthy and thereby leading to a greater elasticity and suppleness of the skin. In these tiring times, we live in a lot of fear and confusion and mental fog. Meditation can help us keep rooted and de-stressed. Meditation is to the mind what exercise is to the body. Hence, 5 to 10 minutes of meditation daily can help you keep focused and then you're able to do things in a more better manner. The health benefits of nuts are well known to all. They are the best friends for your skin and hair because of their omega content and also the other fatty acid content. They help you keep inflammation low, they decrease acne, they keep wrinkles at bay. But just a word of caution while having them, one should ensure that there's portion control as it could lead to excessive calorie consumption.
ये अर्चना आवाज बंद कर.
O is for oxygen. Oxygen detoxifies skin. It reduces wrinkles and increases your collagen production. And definitely, all of us in over here must have heard about ozone facials. It increases cell turnover. It has moisturizer effect, and it is also very good to have oxygen for the cells. Probiotics, they strengthen the skin barrier, improves the skin sensitivity, and are known to be anti-aging. Clinical findings show that certain probiotics can preserve the skin homeostasis by modulating the skin's immune system. Over here, I would like to introduce you all to some me time, which is very essential in today's stressed world. Be kind to yourself and pamper yourself and place your needs and wants also before others because self-care isn't being selfish but it is the need of the hour, so we should all indulge in some amount of me time. Quit bad habits, which can be either smoking because it leads to a lot of oxidative stress and accelerates aging. Say no to weed and drugs. Keep away from toxic chemicals and other inhalations as far as possible. And of course, drinking is bad for your liver. So stay away from all these habits. Resveratrol. Resveratrol is the compound found in grapes, and this has really made red wine the queen of all drinks. This helps you reduce inflammation, slows down aging, protects the skin, and gives even skin tone and hydrates the skin. So be sure to have plenty of resveratrol when in season. It is said that sleep like a baby because it helps your body and mind rejuvenate. For the skin, it helps build collagen, reduces wrinkles and spots, and repairs damage done from UV exposure. Seed cycling is also a very newer concept for hormonal balance. It is understood that seed cycling leads to a better management of your hormones. Seeds are a powerhouse of omega 3 and they provide a range of health benefits. So, do ensure, whether cycling or not, some amount of seeds are definitely there in your diet in terms of flax seeds or chia seeds or your good old sesame seeds or maybe sunflower, anything, but a little bit of seeds should be there around a tablespoon in your diet. T is for turmeric, the gold spice. Who hasn't heard about the Dadima's Uptan? It helps you lighten pigmentation, helps heal skin ailments, works as anti-inflammatory, combats sun damage, and is anti-aging. And turmeric has really become the the king of spice in these COVID times. We've been all having tons and tons of haldi doodh. So it's beauty inside from out to outside. So turmeric has to be had in your daily meal, and it is also used in beauty treatments. I chose a very different U because of the coenzyme Q10, ubiquinol, as the structure is, it helps reduce damage cell activity. It helps fade and prevent dark spots, replenishes the skin cells, and stimulates elastin and collagen production. Therefore, it makes your skin shine and glow. And of course, the coenzyme Q10 benefits to the heart and other organs is not new to dietitians. This is one of our favorite pictures. Eating a well-balanced diet, which includes plenty of protein food, plenty of fruits and vegetables, and a little bit of complex carbohydrate is all that we advise every day. Even to have your liquids is very essential. Adequate intake of liquids is very essential. So our classic food plate is a very simple way of explaining variety in diet. We can, have 50% of your plate full with fruits and vegetables, 25% with protein, as we all know, and 25% with complex carbs. In complex carbs, apart from the carbs, we can also include certain millets. Yeah. So variety in your food is essential. Really urge everybody to go in for the less commonly known foods apart from rather than processed foods. So it is essential that we go back to our roots and have our millets and all of this on a daily basis. As we mentioned earlier, water is very, very important. Our bodies are made up of water maximally because it helps you flush out toxins. Water is important because it prevents dehydration, it maintains the pH balance of the skin, keeps acne at bay, and, and by flushing out toxins, it makes you look younger, prevents the sagging of skin. So have your adequate amount of water. Unless you're on a restriction, you should be having 2.5 to 3 liters of water daily. In these tiring times, one should do a little thing, something extra. Do your social work, because doing what your heart desires sometimes gives you an inner peace and a different high, which cannot be compared to any monetary gain. So help people out, do your little bit for the society, as a corporate social responsibility, or as an individual at an individual level, whatever little you can do for your elders, for your children in society. I think that will give us a lot of satisfaction. Why is for youthfulness? The cosmetic industry is so big in today's day and age is because everybody wants to look youthful. But in order to look healthy and youthful, you should eat very right. Eat healthy and protect your skin from sunburn. As we have heard from experts, remember to apply your sunban cream every 4 hours to protect your skin. Hydrate and get moving. Relax yourself. Then only will youthfulness last a little longer. So it is like eat, work, sleep, repeat. Eat your food, go and do your workouts, sleep and repeat. That is the body has to follow. Zeal for living. Achieving your target in life leads to an increased serotonin production, thereby increasing your happiness. And a happy person, research shows, can live a little longer. So, therefore, this is zeal for living. This was my take on ABCD. I hope you all enjoyed it. Thank you for a patient hearing. We now move on to the next topic where we welcome Dr. Krupali. Dr. Krupali Parekh.
Yeah, hi.
Allow me to introduce Dr. Krupali Parekh. Dr. Krupali Parekh is BDS. Dr. Krupali Parekh is aesthetic, conservative, pediatric, and comprehensive dentistry, and she's expert in her field. She is also a member of the Indian Dental Association, which is also IDA but not Hamara IDA. She is also into many other dental federations. She's been a part of several national. She's been a part of several national and international. Am I? Is it visible?
Yes, it is, Rashika.
Yeah, it is visible. Been a part of several national and international dental conferences. She's been awarded the Best Dentist of the Year award, and she's going to talk about all about smiles. So, are we ready to smile? Come, Dr. Krupali. Hi.
Hi, you can hear me? So they're going to share my PPT, right?
Yes, yes, we will.
Yes.
I'm just waiting for that.
Hello, everyone. Good evening,
Is it visible?
Yes, it is
Yes, it's
visible, but the
visible.
voice is not there.
and thanks for the introduction. And thank you to IDA for having me here. This is Dr. Kripali Parekh, your aesthetic dentist, and I'm going to take you through the journey of smiles from the dentist perspective. So let's get started. Well, the most important remedy to feel beautiful inside out would be to smile. And it's contagious. So smile, and the whole world will smile with you. Why is your smile so important? I'm sure we all have noticed the missing tooth first, even though the man has a missing eyebrow. Because your smile is the first impression that is perceived by people. Apart from feeling beautiful inside out, there are many more reasons to smile. It releases endorphins, which releases stress. It boosts immune system. It increases lifespan. In fact, it is said that your smile adds 7 years to your life. People with good smiles are viewed more confident, attractive, sociable, so it helps with career advancement and potential attracting potential partners. It is easier to smile than frown because it uses less muscles. And in fact, it's the simplest mode to connect and communicate with others. A good smile helps you make a great first impression in all aspects of life. In fact, research says that people with brighter, straighter smiles are more likely to be hired or promoted and offered a higher salary. So, what is a good smile is the big question, right? To begin with, let's just take a look at these few celebrity faces and you pick your choice of face. Which ones do you find desirable? Or which smile do you find appealing and which faces seem unattractive to you? I think we all would agree over here that in all these faces, the smile is the most striking feature, which makes each one either desirable or undesirable. So, in the perfect smile, in layman terms, a good smile would be your best smile, something which you can, confidently flaunt to the world without being conscious or embarrassed. But in the dental language, a good smile would be based on a lot more other factors, like, it should be a broad smile with minimal dark spaces in the corners. There should be minimal amount of gum showing. Teeth should be upright, taking care of the facial symmetry, proper bite, and also, considering the age, sex, and the personality of the person. Like a younger person will have longer teeth. A person which is older will have shorter teeth, showing little, signs of wear. Even like a male would have hard,
Mama, you want milk?
cuboidal, vigorous-looking upper teeth, and for female, we usually give round, soft, delicate-looking teeth. And also the personality and the profession they hail from. All these factors are considered in giving them their perfect smile. Um, so not all of us over here, are blessed with the perfect smile, of course. And I have seen so many individuals, in fact, cringing to smile or covering their smiles, and because of which they have low self-esteem and are always, always conscious and embarrassed over their teeth. So this is the time I would say to go see your dentist and take his opinion because they can truly do wonders to give you your perfect smile. Uh, so, did you know that the shape and size of your smile can reveal a lot about your personality? Yes, it's true. Apart from astrologers and fortune tellers, even teeth can predict a lot about you actually. And so, when you're flashing those pearly whites, you may be sending out some message to your fellow peers, which could determine your success personally and professionally. So let's take a look here. There are four personality types based on the teeth and smile shape and size. So you all can go home and check your smiles in the mirror today and see what your smile has to tell you. An oval shaped smile or a melancholic smile. A most prominent characteristic is that they are very artistic, organized, but they are also very timid, sensitive, and reserved. Triangular shaped teeth or a sanguine smile, they characterize dynamism. So people with triangular teeth are carefree, impulsive, extrovert. They seize the moment and they love to live in the present. Rectangular shaped teeth or a choleric smile, Very practical people, objective, and a good planners, entrepreneurs. They are an idea box, so they're very imaginative and passionate. And you have even square shaped teeth or a phlegmatic smile. They are diplomatic, ambitious, calm, spiritual people. They have a good sense of control and good judgment. So, and this is also one of the reasons why models and celebrities, politicians, they change their smiles because the person they are does not match the impression and the message that the teeth is giving out to the world about them. Dentistry today has evolved and advanced remarkably to correct any tooth related defect and be able to give every individual their perfect, most desired aesthetic smile that blends well with your facial features and personality. And this, in simple terms, is smile designing or smile makeover or smile enhancement, whatever you may call it. It can truly create magic, to fully restore your dental health and enhance your appearance, no matter whatever is the state of your existing teeth. In fact, a smile is the best makeup you can wear. So it is imperative to wear your best smile. So, who is a candidate for smile designing? Or how do we know whether we need smile designing or not? Basically, any individual having discolored teeth, chipped teeth, rotated, crooked teeth, missing teeth, or spaces, gaps between teeth, even teeth that are tipped inside or are jutting out, gummy smiles or pigmented gums are all cases requiring some kind of smile designing, or even simply anybody who wants to enhance and transform their existing smile to look younger and more confident. Another fun fact, yes, actress Julia Roberts had once insured her smile for $30 million. Well, that's the worth of a beautiful smile, I would say. Depending on the correction to be done, there are many smile enhancement options available, such as bleaching, bonding, veneers, crowns and bridges, enamel contouring, braces, implants, periodontal procedures, tooth jewelry. So let me just quickly take you through few cases and give you an understanding of each option in brief. Bleaching is basically teeth whitening that uses a chemical process to lighten your teeth shade and whiten your teeth. Just like how you bleach your face and you bleach your hair, this too is temporary and lasts for few months. You have home bleach systems which you can use at home and do it yourself, and office bleach which is done in the dental office by a professional with higher concentration. And the best and instant results are, of course, seen with office bleach or a combination of both. Bleaching is a simple, quick fix option for yellowish discolored teeth, especially for weddings and special occasions. In this case, you can see here where bleaching was done for one of our NRI patients. She's a counselor, so her profession too demanded a brighter looking smile. You can see the before and after results, how satisfactory they are. Bonding with composites, I'm sure you all may have heard of this word before. It's a tooth colored filling in repair material to repair chipped broken teeth or hide cracks, fix stained teeth, or even fill cavities. It can also be used to close minor gaps between teeth and also replace old silver fillings in the mouth, as you can see in the picture. Silver fillings, let me tell you all, are obsolete now. And besides the dentist, trust me, it's only perceived as black cavities by others when you open your mouth to talk, especially your lower teeth. So, always a good idea to change your silver fillings in the lower teeth at least. Composites is referred as the wonder filling in dentistry because it can actually do wonders in just a single visit also. This is a minor chipped tooth that we repaired with composites for one of our patients. In fact, she is also a registered dietitian herself. Very minor correction, but it enhances the smile significantly, as you can see. Here we have used composites to build up his broken teeth and match the shade of both his teeth to make them look uniform. You can see in the before picture that both his front teeth are of two different shades. So we've taken care of that too with composites. Veneers. Veneers are basically, nails in shells, typically made of porcelain that cover the front sides of the teeth. And they're used for minor corrections, like to hide minor gaps between teeth or to change the color of the teeth permanently, or to correct crooked teeth, poorly shaped teeth, or even repair chips and cracks on teeth. Veneers are either direct, which are made there and then by the dentist and cemented onto the tooth immediately, or the indirect, which are made in the lab and they are then later cemented onto the tooth. Here we have made direct composite veneers due to time constraint for our patient. She is a senior fashion editor with Vogue magazine, and she wanted to wear her best wedding smile for her big day. Here you can see, where this is a wedding pic where she's so confidently and happily flaunting her smile. And this, in fact, is the most gratifying thing about our profession, to see our patients happy to wear their dream smile. This is what makes us also the happiest. Crowns and bridges are another option. Crowns are single caps for teeth, and when more than one crown are joined together, it's called a bridge. Bridges are mainly used for missing teeth, as you can see in the picture also. And crowns and bridges are made of many different kind of materials, with zirconia crowns being the most recent and most advanced material, and also the most preferred anesthetic for smile makeovers. Crowns and bridges can be used from any and all kind of minor and major corrections to enhance or transform your smile just the way you like. You can see in the picture also on the left how a yellowish smile with squarish teeth is transformed beautifully with crowns in just the upper four teeth. Here we have done a full mouth rehabilitation to give the patient a pleasing smile. You can see the before and after pictures and appreciate the magic of crowns. It can actually correct anything and everything. In this slide here, we have done smile designing for this patient with zirconia crowns. She is a model and was very specific with, how she wanted her smile to be, and we could give her her dream smile with these crowns. Did you know that the same shade of teeth appear yellowish in a fairer person and whiter on a darker complexion person? So if you notice, like Dimple Kapadia, for instance, her teeth, I mean, they are a little on the yellowish side, but they appear a lot more yellower because of a fair complexion. And if you happen to see black people, their teeth always look, shining bright because of the darker complexion. In fact, a quick tip for women, I would say, is always wear red lipstick or a darker shade of lipstick if you want your teeth to appear whiter and brighter. Braces. Today, mostly people of all ages are benefiting from braces. With the current advances in braces, it's now a preferred option by many for smile corrections. We also have now lingual braces or invisible braces, as people call it, which are placed on the inner surfaces of the teeth and they are not visible. And also, we have clear liners, which are transparent trays fitted to your teeth, making them invisible to others. You can see all types of braces in the pictures, and lingual braces and clear liners are on the extreme left. Braces not only improve the teeth alignment, but also, the look of the person, because they can also correct your bite and many jaw deformities too. So here we have corrected this patient's smile with lingual braces, which are placed on the inner surfaces of the teeth, as I mentioned. And she had spacing. You can see, she had like a lot of spacing in her between her front teeth, and space, and also she had teeth jutting out, so it's very visible, and it looks really bad when you are talking and smiling. And she is a lifestyle blogger. You can see, how with braces there is a major transformation in her smile post treatment. In fact, we have, if you see, we have only corrected the upper teeth. In the lower teeth, we hadn't put braces. So only the upper teeth correction also has enhanced her smile, significantly. Implants is the most current advancement in dentistry. These are titanium rods inserted in the bone for replacing missing teeth. So they're an alternative to bridges, a much better alternative, in fact, because in bridges, we also need to cap the tooth ahead and behind the missing space. But in implants, you do not touch the neighboring teeth. So this is like the biggest advantage that implants have over braces. In my practice, actually, I have, come across many patients who fear the word implants for some reason because, of stories that they've heard from others. The thing is that implants have few specifications and, it can only be placed if the bone condition and other medical parameters are favorable. So, you can't just put an implant in any and every case. It's, of course, the best choice, I would say, for missing teeth, provided implant requirements are taken care of. And implants are usually done in two stages. Here you can see in the picture, we have inserted multiple implants for this Arab patient. First stage, we inserted oral implants, and in the second stage, we gave her her crown. So, from an empty smile with no upper teeth, we could actually give her a fulfilling smile with, nice teeth. Apart from teeth correction, there are also procedures to correct gum problems, which are a hindrance to your smile. Like you have a gummy smile where too much gums show when a person smiles, or there, people with grayish black pigmentation in gums you might have seen, or even, people have uneven gum line or exposed roots. In this picture, you can see on the right, you can see the difference in gum pigmentation after the procedure, and also the gum line is improved to make the teeth look longer, if you can, notice that. And on the left, you can see that how exposed roots are corrected with gum surgery again. Here we have done a gummy smile correction for a patient, again for a wedding. Unfortunately, I don't have a clear picture, zoomed in picture for her gummy smile. But she was very conscious always, and she always tried pulling her lips down to cover her gums whenever she would smile. So it was nice to see her smile, confidently for her wedding day. Coming to the last option for smile beautification is tooth jewelry. Some people want to have a dazzling smile in the literal sense. So for that also we have something where we can bond or stick a diamond or golden stud onto the tooth, whatever you prefer. And this procedure is reversible. So, in case later, whenever you are bored of it and you want to, get it out, you can also do that. Well, this sums it all up, and I hope I've inspired you all enough to smile and wear your best smile. In fact, research says that 61% people have been attracted to somebody with just their smile alone. So, what better time than Christmas to find your Santa? Everyone here, let's make this New Year's resolution to smile wide and smile right. Thank you. This is Dr. Kripali Parekh, hoping to spread more smile.
Thank you, Dr. Kripali Parekh. Indeed, it was a very good session, and it led us to coming to coming from you. It made us aware of all the different current practices in dentistry. Moving further,
Thank you so much for having me here. Thank you.
we now move on. We've done with hair. We've done with good skin. We've done with a good smile. Now we move on to grooming. Grooming is essentially a women's tool. And today we have with us the grooming expert, who is a very dear friend. Ruchi Gupta, she has completed her graduation in arts and also an integrated design course in technology from the Nottingham Trent University in UK. She has trained models for various assignments for the prestigious Miss India and Acne fashion show. She has conducted grooming sessions and participated for participants in the beauty pageants nationally and internationally. And currently, she's doing a lot of corporate clients. So please join me in welcoming Ruchi Gupta's session.
Hello to my dear all. I begin with this informal greeting as I consider today we are on this platform this evening to impart tips and secrets to each one of you to bring out the stunning you in the most friendly manner. My dear Rashika, I want to congratulate you as you hold polite tone wherein you convince people in just one statement without putting pressure on them and incline them to be a part of a noble cause. You did it with me, and let me tell you, you're already groomed and impactful. So, as I proceed with the grooming strokes on the canvas of minds, let me take you all back to the fairyland. But before I take you there, please note of two most important things. Grooming cannot be confined to a module or a capsule, but fortunately, a lot of grooming aspects have been covered by the other extreme panelists who did it brilliantly, which I'll not be touching here. But throughout my conversation, I will be using certain verbally highlighted words. My request to you all, if you can make a note of them, as each word holds a hidden or apparent grooming tool to it. Secondly, now onwards, throughout my speech, I will be using the word grooming with self-care and self-love, which leads to an impression, long-lasting impression, in the minds of people with whom we come in touch with. So now as I open the book of Cinderella for you all, Cinderella was a plain girl who was transformed into this stunning beauty by fairy godmother, and she adapted to this change or transformation flawlessly. She goes to this prince's palace and there she carries herself confidently. As she's proposed by the prince to do a ball dance with him, she accepted the proposal gracefully and she danced with him as a skilled dancer. As the clock struck 12, as a disciplined girl, she left the palace. Yes, in a hurry, her slipper got slipped, which again gives us a tip that add-ons always leave an impression. So, what are the tools we gather from this Cinderella story? First and the foremost, what we gather is self-care. There it was change, transformation. Fairy godmother transformed Cinderella to this ethereal beauty. But here we talk about the fairy godmother existing in ourselves. You have to be your own fairy godmother to bring out this change in yourself. So the first thing is
જો આમાં આ તો ફ્રીની ચા છે ને તો તમે ઓલાને
In
પૈસા જ
fact,
ના આપે ચાના
just few days back,
છે ને
around the
દુકાનમાં
Bali
પીધી
time,
હોતે
I saw
હોટલમાં તો તમે તો ઓલાને
this
પૈસા જ
cartoon.
ના
It
આપતે
said,
ચાના
I want to do the cleaning of my surroundings, but I'm going to look after myself till the time the feeling goes away. So I am not saying that don't groom
ને
your
બધામાં છે ને
surroundings,
હેલ્થના
but at the
ઉપર
same
બધા અલગ
time,
Requesting all participants to please put your mics on mute.
you have to keep yourself first. You have to prioritize yourself first. And self-care is the most important tool of grooming. Self-care leads to self-love. Mirror, mirror on the wall, who's the prettiest of all? Yes, the people who have attended my capsules before, they know that I always guide to carry a mirror everywhere you go to make sure you're prim and proper all the time. But at the same time, you have to carry a mirror inside. The moment you are taken care by yourself, this will lead to self-love, and you don't even have to ask this question, who's the prettiest? Because whether you are 18 or you're 80, you know you are the prettiest because you are taken care of yourself. So self-care, which leads to self-love,
It's 6
which leads
o'clock.
to self-pampering. The moment you are taken care, the moment you know that you are the prettiest of all, you will automatically pamper yourself further. I am the prettiest of all, and I have to further ensure that I look prettiest of all the time. Irrespective of my age, please underline it. Then comes self-confidence. The moment you are taken care, the moment you are self-loved, the moment you are self-pampered, it leads to self-confidence. You will compliment yourself, people around you will compliment you, and automatically that confidence will emerge. After confidence, another tool which comes is self-discipline. You and your efforts have to be consistent. Taking care of yourself is not like taking care of the surrounding once in a while. It is a consistent effort. You have to look after yourself consistently to emerge that beautiful you in yourself. Now, if you notice, all these tools have one center word, in quotes, self. So everything comes from self. The moment the effort is from you, you will emerge as the fairy tale beauty, just like Cinderella. And please make a note, for all this, you do not have to spend a bomb to look good. With consistent effort, with certain consistent grooming tools as you adapt, and most important is self-care, you will be there as a princess looking all the time without spending too much on it. I certainly believe once it's your consistent effort, you don't have to do that artificial grooming to yourself. Automatically, you will look naturally good and all the time good. Another tool which you all have to remember is variety. You are dietitians and you know variety plays such an important role in one's life. You provide the nutrition to your clients, but at the same time, you provide variety to them. The nutrition remains the same, but the menu chart with variety change all the time. So for this change, you have to add this change in your life as well. A little bit alteration of the lengths of your dresses, a little bit alteration in your hairstyle, little bit change in the way you look, maybe a change from Western to Indian to fusion, and that kind of a change which brings newness in you. Maybe just a change by adding maybe some jewelry to yourself, or even by changing a nail paint shade or a lipstick shade. But that change adds dazzle to the life. And who knows it better than you all? In fact, please don't remain that misconception that change and certain kind of dressing up is only for 36, 26, 36, or for only a certain age bracket. It's just a myth, underlined myth. At whatever age, you can still experiment, and please experiment. Yes, just like as you convey to people that desserts are in moderation, change in moderation, gradual change. But please adapt to the change in your life when it comes to looking the best. Further, in fact, as I come back to, please don't even think that if you are whatever waist, whatever age bracket, you don't lose hope for bringing change in the way you look. I was at Switzerland and there I saw this 80 years old woman sitting and having a coffee in the cafeteria. She was dressed up. In fact, let me tell you, she was 5 feet few inches with 45 waist. But she was wearing a stunning short dress with matching sneakers to it. Also a cap, I remember, on her silvery hair. And she had the manicured hands. And with so much of elan, the way she was sipping her coffee, her wrinkled hands as if raising a fashion statement. And the catch of the entire thing is her posture. The posture can make you look years younger. And remember, girls and women out there, there is so much what you can do with your posture. In fact, as dietitians, when you visit patients, when the doctors visit the patient,
Off your mind.
and the attendants focuses on recovery. The nurses are judged by how they take care, but you carry a huge responsibility on your shoulders because when you interact with patients and the attendants, the focus around also along with food is on you, how you are groomed. So you're carrying that responsibility of your institution on your shoulders. Would you like to visit a place, eating place, which is not well kept, well lit, or dazzled? So it's so important for you to look groomed, to convey to the relatives and the patient and your clients that you practice what you preach. You provide them the best food, but at the same time, you know to look after yourself, to look after their bodies. I always believe in this very strong saying, if you can look after yourself, you can look after everything. And if you can't look after yourself, you cannot look after anything well. So, and as I said, posture, coming back to it, it's so important. Unfortunately, right now I cannot talk in detail about posture, but I will try to give some handout, some tips to Rashika to be conveyed to you all about posture. So, my dear all, I end on this note that I would request you all to become Santa for yourself this season, to become fairy godmother for yourself this season, and pamper yourself to the fullest. So, with this note, I, Ruchi Gupta, sign off. Loads of love, loads of kisses, and loads of self realization that next you don't even have to ask, mirror, mirror on the wall, you will say, I'm the best of all.
Indeed, that was a fantastic session on grooming, and I'll be more than happy to share Ruchi's knowledge with all of you all when she gives me the further slides. Moving further to our last session for the day, which is on yoga by Miss Smita Gadge. She has been a yoga instructor and fitness course. She's done her diploma in yoga education from Kevalia Dham. Also, she's an MA in yoga from the Uttarakhand University, and she's been the first Dan black belt in Taekwondo, karate gold medalist from the Mumbai University, state level martial art championship gold winner, and owner of the Wellista Fitness Studio, Mumbai. We now have her recording.
Hello, hi, good evening, friends. My name is Sumita Siddharth Khadge. I have been a yoga instructor for the last 10 years, and today we are going to discuss about the topic beauty. Beauty is like a very close topic of each and every woman and at the all ages. So, we are going to describe this beauty in a language of yoga. Okay, so but I like to give you a small introduction about yoga. Yoga is basic meaning of yoga, that is the union. Union का मतलब होता है जोड़ना. Okay, तो yoga is the make union between your body, mind, and soul. Okay, and in a yogic term, when going to describe about the beauty, the I find out there are the three kinds of the beauty. That beauty is beautiful body, beautiful mind, and beautiful soul. That is, as a yoga practitioner, as a yoga teacher, I find out yoga is like an amazing journey for absolute beautiful life. Okay, popularly means we know everyone. There are the main practices in yoga, that is asanas, meditation, breathing practices, that is known as the pranayam. These all are the like very popularly known practices. But now I want to explain you okay, how all these yoga practices help you to improve your beauty. Beauty is not only outer physical beauty, that beauty of your body, mind, and soul. Okay, so I like to explain you all these things, so please all of you listen carefully. Asana is like a physical exercises part. So asanas are basically for your beautiful body. When we start to do exercises, that means the asanas are like holding and stretching postures. That's good for to lose your body fat. At the same time, it's improve your body strength, improve your muscle quality, improve your flexibility. And then very important, asan practice. Okay, yeah, asans practice jo hai, it's more related to your internal systems. ओके, बिकॉज मोस्ट ऑफ द प्रॉब्लम्स, ओके, आउट ऑफ फिजिकल बॉडी का जो भी प्रॉब्लम्स है, मोस्ट ऑफ द वी सफर दैट प्रॉब्लम बिकॉज ऑफ अवर इंटरनल सिस्टम, लाइक डाइजेस्टिव सिस्टम, our endocrine system and nervous system. These are three important things. How? I explain you now. Okay, stress. Okay, stress is related to your nervous system. Okay, indigestion, constipation, your any hair and skin issues is more related to your digestive system. And then endocrine system, that means your hormonal issues. Okay, and most of the जब भी हार्मोनल इम्बैलेंस होते हैं तो मे बी वेट पुट ऑन होने के चांसेस होते हैं, हेयर लॉस, स्किन डार्क होना, ये सारी चीज़ें होती है. ओके, बट व्हेन यू स्टार्ट द आसन प्रैक्टिस, द योगा प्रैक्टिसेस, तो व्हाट हैपन्स व्हेन यू स्टार्ट टू डू ऑल दिस आसन, दिस ऑल द आसन्स आर वर्क ऑन योर इंटरनल सिस्टम. और जब आपके इंटरनल सिस्टम पे इसका इम्पैक्ट पॉजिटिव वे से होने लगता है तो ऑटोमेटिकली योर इंटरनल सिस्टम इज बिकम मोर स्ट्रॉन्ग. ओके, आपके हार्मोनल लेवल जो है वो बैलेंस होने लगते हैं. ओके, तो बेसिकली जो हमारे बेसिक प्रॉब्लम्स होते हैं, लाइक वेट पुट ऑन किया है उसको लूज करने के लिए हेल्प होती है. अगर वेट हेयर लॉस हो रहा है या स्किन के कुछ भी इश्यूज है या इंडाइजेशन है, कॉन्स्टिपेशन है, तो ये सारी प्रॉब्लम्स को स्लोली स्लोली कूल डाउन करने के लिए, सेटल डाउन करने के लिए आसन्स हेल्प करते हैं. तो आसन्स आर अमेजिंग प्रैक्टिसेस फॉर योर physical body, especially for your internal system. And when your internal system is improved, that improvement is reflect on your outer physical body, and that is very very important. Then second thing, okay, if you are a physically strong, see if आप physically strong और mentally बहुत depressed हो, तो that thing is again reflect on your face, reflect on your outer physical body. You know, most of the time हमारे चेहरे से ही पता चलता है कि आप डिस्टर्ब हो, आप गुस्से में हो. Okay, so that is the reflection of your mood. Mood is related to your mind. Understand? So that means the relaxation of your mind, peace of your mind, पॉजिटिविटी ऑफ योर माइंड इज वेरी वेरी इंपॉर्टेंट. और ये सारी चीज़ें कब पॉसिबल है? व्हेन यू आर डूइंग लाइक गुड प्राणायाम प्रैक्टिसेस. Okay, as well as you can there are the like many more options. It's not only a pranayam, but you can do the like basic pranayam. That is amazing thing. Then you can do like any hobby. You can involve yourself in जिसमें भी आपको अच्छा लगता है, जो भी करने के लिए आपको अच्छा लगता है, लाइक सिंगिंग है, डांसिंग है, whatever. तो इससे आपका माइंड जो है वो रिलैक्स होता. तो दैट इज लाइक अ हॉबी इज अगेन लाइक अ बेस्ट ऑप्शन टू रिलैक्स योर mind. And then the one more thing is like a prayers. When you listen the prayers and all, automatically positivity is increased in your mental body, and that mental body positivity is again reflect on your outer physical body. And then strong mind and then strong body is a perfect health. तो हेल्थ किसे कहते हैं? हेल्थ मीन्स मेंटली फिट होना एंड फिजिकली फिट होना. ओके, एंड व्हेन यू आर मेंटली एंड फिजिकली कंप्लीटली फिट, तो दैट पॉजिटिविटी इज रिफ्लेक्ट फ्रॉम योर ऑल द एक्टिविटीज. आपके हर एक एक्टिविटी से वो पॉजिटिविटी दिखती है. ओके, और ये जो सारी चीज़ें, जो भी चीज़ जब भी आप पॉजिटिव रहते हैं उसका रिफ्लेक्शन आपके फेस पे आता है. ओके, आपकी स्किन ऑटोमेटिकली ग्लो करने लगती है. दैट इज वेरी इंपॉर्टेंट थिंग. दिस इज राइट. ओके, क्योंकि किसी के बोलने से आपको कुछ समझ में नहीं आएगा. जब आप ये सारी चीज़ें अपने आप फॉलो करने की कोशिश करोगे, देन यू अंडरस्टैंड कि ये सारी चीज़ों में आपको जो बता रही हूँ वो कितनी इफेक्टिव है और इसमें कितना 100% सच है. ओके, देन आई जस्ट लाइक टू एक्सप्लेन यू लिटिल अबाउट द प्राणायाम. जैसे प्राणायाम की एक पॉपुलरली नॉन प्रैक्टिस है, दैट इज द कपालभाति. बट आई लाइक टू एक्सप्लेन यू, कपालभाति इज नॉट अ प्राणायाम. ओके, कपालभाति इज वन काइंड ऑफ द शुद्धि क्रिया. ओके, कपालभाति के नाम में ही है. देखो, कपाल का मतलब होता है फोरहेड एंड भाति का मतलब होता है शाइन. दैट मीन्स द शाइन ऑन योर फोरहेड. ओके, मोस्ट ऑफ दोज पीपल आर सफरिंग फ्रॉम द साइनस इशू. अगर आपने देखा होगा उसका रिफ्लेक्शन आउटर फिजिकल बॉडी पे क्या है? पिंपल्स. ओके, दैट इज द मेजर साइन. अगर चेहरे पे बहुत सारे पिंपल्स दिखेंगे आपको. ओके, बट जब आप कपालभाति की प्रैक्टिस करते हो तो क्विक एक्सहेलेशन के स्ट्रोक्स से जो भी एक्सेस म्यूकस है वो रिमूव होने के लिए हेल्प होती है, और ऑटोमेटिकली आपके स्किन एरिया से, आपके फेस एरिया से जो इम्प्योरिटी है वो स्लोली स्लोली कम होने लगती है, और उसका रिफ्लेक्शन जो है for repetition. Okay, that is again depend on your capacity. And always for Kapalbhati हमेशा empty stomach करना चाहिए. And then important thing is try to do in a morning time. That is always best. देन द नेक्स्ट थिंग कपालभाति जैसे स्किन के लिए, और दिस इज शुद्धि क्रिया, दैट मीन जो आपके नजल कैविटी को क्लीन करती है, जिससे आपकी ब्रीथ इंप्रूव होती है. और जब आपकी ब्रीदिंग इंप्रूव होती है तो ऑटोमेटिकली आपके बॉडी के अंदर ऑक्सीजन सप्लाई जो है वो इम्प्रूव होने लगता है, जिससे आपके इंटरनल सिस्टम में ऑर्गन्स के लिए जो फंक्शनिंग के लिए ऑक्सीजन चाहिए वो प्रॉपर ऑक्सीजन सही मात्रा में मिलता है. तो इंटरनल सिस्टम भी आहिस्ता आहिस्ता अपना फंक्शन इम्प्रूव करती है, स्ट्रॉन्ग बनती है, और ये सारी जो चीज़ें हैं वो रिफ्लेक्ट करती है आपके आउटर फिजिकल बॉडी पे, जिससे आपके हार्मोन्स सेटल डाउन होने के लिए, रिलैक्स होने के लिए हेल्प होती है, मेंटल बॉडी को रिलैक्सेशन मिलता है. ओके और जब आपकी बॉडी, फिजिकल बॉडी और मेंटल बॉडी कंप्लीटली रिलैक्स है, पॉजिटिव है, तो ऑटोमेटिकली इसका रिलेशन आपके ब्यूटी से है. ओके जो ऑटोमेटिकली आपके आउटर फिजिकल बॉडी पे इसका इफेक्ट होगा, जो इफेक्ट है आपकी स्किन ग्लो करने के लिए, आपके हेयर लॉस के प्रॉब्लम को सॉल्व करने के लिए. ओके एंड एट द सेम टाइम बिग स्माइल ऑन योर फेस, क्योंकि पॉजिटिव पर्सन हमेशा एक स्माइल करते हैं. दैट स्माइल इज योर आइडेंटिटी. दैट इज वेरी वेरी इंपॉर्टेंट थिंग. Okay, then the next thing, when we want to completely pure from inside, that purity is also reflect on your outer physical body. And how can we improve that purity? Okay, so important thing, first we have to remove our impurity and we have to practice for the purity. Understand? We have to remove that impurity and we have to practice for purity. Okay, for the purity you can do meditation. Okay, meditation is like a amazing practice. You can do the omkar jap या any kind of the prayer जो आपसे क्लोज हो, आपके हार्ट के नज़दीक हो, जो भी आपको पसंद हो, तो यू कैन डू दैट काइंड ऑफ द मेडिटेशन प्रैक्टिसेस, प्रेयर प्रैक्टिसेस, ओमकार जप. तो दिस ऑल द थिंग्स आर ऑटोमेटिकली improve the purity in your body. Understand? So basically I explain you about the asana, pranayam and meditation. And when you make a proper coordination with this all these practices, so automatically you work on your physical body, mental body, and you automatically upgrade your soul. That means you are increasing the purity in your body, and that purity is a reflect on your outer physical body. That is very important. So please understand about your inner body and outer body. Okay, then I want to explain you a little more things like our body is every person have some tatva मतलब body जो है वो वात, पित्त और कफ, ये तीनों तत्व से बनी हुई है. ओके हर एक के बॉडी में ये तीनों तत्व होते हैं. बट वेरी इंपॉर्टेंट थिंग कि हर एक के बॉडी के अंदर कोई एक तत्व जो होता है वो थोड़ा डोमिनेटिंग होता है. ओके किसी की बॉडी पित्तकर प्रकृति की होती है, ओके किसी की वात या फिर किसी की कफ. तो अकॉर्डिंग टू ऑल दिस थिंग्स हमारा डाइट होना चाहिए. ओके तो बेसिकली हमें सब पता है कि क्या बॉडी के लिए अच्छा है क्या नहीं है. ओके तो आई डोंट वांट टू एक्सप्लेन ऑल दैट थिंग्स बिकॉज हर एक के अंदर एक छोटा सा डाइटिशियन होता ही है. अगर हमारे सामने बर्गर है और हमारे सामने एक स्प्राउट का चाट है, ओके तो हमें पता है कि बर्गर हेल्दी है कि स्प्राउट चाट हेल्दी है. Understand? So I don't want to explain all that things to you, but I like to explain you about the more about yoga. Yoga have like many more practices like a shuddhi kriya also, like a very popularly known as a woman. Woman is one of the shuddhi kriya. Woman body के अंदर की impurity को ओके एक्सेस एसिडिटी को, कफ को रिड्यूस करने के लिए हेल्प करती है. ओके वमन क्रिया आपके डाइजेस्टिव सिस्टम को स्ट्रांग बनाती है. तो वमन इज व्हाट? वमन इज मॉर्निंग टाइम पे आपको वार्म वाटर पीना है एज पर योर कैपेसिटी, एंड देन सिर्फ स्टमक को हल्का पुल करके, या अदरवाइज जस्ट टू फिंगर्स पुट इन योर थ्रोट्स एंड जस्ट रिमूव ऑल दैट वाटर. बट ये जो प्रैक्टिस है वो अर्ली मॉर्निंग एम्प्टी स्टमक ही आपको करनी है. यू कैन लाइक एज अ बिगनर यू कैन डू वंस अ वीक. तो दिस प्रैक्टिस इज लाइक अगेन अमेजिंग, बिकॉज बॉडी के अंदर से इम्प्योरिटी रिमूव होना दैट इज वेरी इंपॉर्टेंट, क्योंकि बॉडी के अंदर की इम्प्योरिटी ही हमारे आउटर फिजिकल बॉडी को या हमारे फिजिकल बॉडी को डैमेज करती है. जो भी हमारे बॉडी के सफरिंग्स है, अगर आप देखोगे इफ यू आर सफरिंग फ्रॉम साइनस, तो दैट इज द रिलेटेड टू साइनस, ओके, कफ. Okay, if you're suffering from any acidity issue या indigestion, vomiting sensation या फिर then headache and all, तो it's related to your acidity. Okay, if you're suffering from any bloating issue, okay, joint pains and all, is related to what. Okay, so when you're suffering from all this problem, that time how can you focus on your beauty? Understand? Because beauty is like ये अंदर से आना चाहिए. ओके, हम लोग कितने भी अच्छे कपड़े पहने, हम लोग कितना भी अच्छे से मेकअप कर ले, ओके, जब तक वो पॉजिटिविटी प्योरिटी चेहरे पे नहीं आएगी, आपके बॉडी के अंदर नहीं आएगी, आप आपकी वो ब्यूटी को एंजॉय नहीं कर पाओगे. दैट इज वेरी इंपॉर्टेंट. अंडरस्टैंड? तो लाइक अ पीस ऑफ माइंड इज वेरी इंपॉर्टेंट. ओके, और ये सारी चीज़ें कब पॉसिबल है? जब यू हैव अ परफेक्ट बैलेंस बिटवीन द body, mind and soul, vata, pitta and kapha. Okay, and for this balancing I told you about the Vaman Kriyam. At the same time you can do the asan practices. Is asan, there is again like a very beautiful practices. For the hair loss you can do the Shirshasana, that is the head standing practices. Sarvangasana is again amazing practice. Then for the basically फैट लॉस के लिए स्टैंडिंग प्रैक्टिसेस काफ़ी अच्छी है, जिसमें त्रिकोणासन है, उसके बाद स्टैंडिंग ताड़ासन प्रैक्टिसेस है, फॉरवर्ड बेंडिंग, बैकवर्ड बेंडिंग है, ओके, ट्विस्टिंग प्रैक्टिसेस है, दैट्स गुड फॉर योर स्पाइन एंड फ्लेक्सिबिलिटी. देन देर आर द मेनी मोर प्रैक्टिसेस स्पेशली फॉर योर एंडोक्राइन सिस्टम, दैट इज जानु वक्षासन है, शशकासन है, उसके बाद सर्वांगासन है, हलासन है. दिस प्रैक्टिसेस आर स्पेशली फॉर योर एंडोक्राइन सिस्टम, दैट मीन्स योर हार्मोनल इश्यूज. आपसे पीरियड से रिलेटेड जो भी इश्यूज होंगे, इफ यू आर डूइंग ऑल दिस प्रैक्टिसेस, तो इट्स लाइक रियली हेल्पफुल फॉर यू. ओके, तो इम्पॉर्टेंट थिंग अगेन आई लाइक टू एक्सप्लेन यू कि ब्यूटी इज नॉट ओनली हाउ यू लुक, हाउ यू फेयर. Okay, beauty is completely depend on your mental peace and purity of your soul, and only that thing is a reflect on your outer physical body, and as a yoga practitioner and teacher, that is the actually absolute beauty. Thank you so much. Hope you enjoy this session, you like all this thing, whatever I explain you, and thanks for this opportunity. Bye, take care.
Indeed, it was a fantastic session on yoga. We all know about yoga from our very dear Nazneen Hussain. Nonetheless, few new tips are always welcome. So, with this, we come to the end of our expert speakers. And now I'd like to welcome. It is my pride and privilege to welcome our very own National President, Indian Dietetic Association, Dr. Jagmeet Madan, who is a philanthropic person. She is the Principal Professor, Department of Foods and Nutrition and Dietetics, SVT College of Home Science, and SNDT Women's University. She is the Indian representative for the Asian Federation of Dietetic Association and also for the International Confederation of Dietetic Association. Madam is an expert FSSAI scientific panels on labeling and claims advertisements and an expert scientific panel of nutrition and fortification. She is an institute herself and we have all learned from her. She is also the Scientific Advisory Committee member of PFNDAI 2019 to 21. It is my privilege to invite her for the question and answer session. Along with her, I also invite Neeti Aniti Desai, who is consultant nutritionist, and she's the co-convener of this program today. She practices in South Mumbai and has been attached to Kambala Hill Hospital for 17 years. She's been the secretary for the Association of Diabetic uh, Educators. Of course, she is the joint treasurer of IDA Mumbai chapter. She is the co-editor of our IDA clinical manual. 2018, she has regular columns in health and nutrition magazines and has been the official nutritionist for Femina Miss India 2008. Over to you, Neeti and ma'am.
Right. Thank you, Rashika, for that kind introduction. Dr. Madan has just sent her apologies. Something urgent has come up at workplace, so she will not be able to join. So we're going to start our question answer session. After the very beautiful session Inside Out, from all our speakers, I have a few questions which we have gathered. If I start with Dr. Vibha,
Yes, ma'am.
We as nutritionists always check at hemoglobin, low protein intake when people complain about hair fall. So is just checking hemoglobin important, or iron studies, especially ferritin estimation, is also important, and why?
We definitely do ferritin estimation if there is an advanced degree of hair fall, which you think you have given them all the supplements, all the protein is taken in. First, we also rule out their hormonal profile by history taking. We find their menstrual history, we find all these things, and then if required, we go for a detailed ferritin study.
Right. Also, in Indian women, we find that the hair is basically there's oily scalp and dry hair. It's a combination. So, what is the hair care suggestions for them? So, do we use a shampoo for oily hair or for dry hair?
So, ma'am, what I always tell my patients, the harsher is the shampoo. So, the shampoos which are typically used for oily hair or for anti-dandruff shampoos which we get, they usually strip off all the moisture from the scalp, yielding it more dry. So, if you are a patient with oily hair, we rather tell them that you wash your hair more frequently and still stick to a daily care shampoo. Do not use an anti-dandruff or a very harsh shampoo because that later on causes a lot of frizz and the vicious cycle continues. And we also have the scalp. Basically, when we try to remove the excess moisture from our scalp, it has a tendency to throw out more oil. So it will yield more oil and the cycle just continues. So prefer frequent washes, maybe alternate days or maybe daily with a pH balanced shampoo. It helps the patient a lot.
Right.
Certain applications like certain ketoconazole applications also help to keep this at bay, the oily
Oily
secretions.
scalp.
And of course, for our dry scalp, we prefer as gentle as shampoos. The current trend of your sulfate-free shampoos, paraben-free shampoos definitely helps the patient.
Great. Thank you. The next question is for Dr. Sama. So we as dietitians, nutritionists ask our patients to, be in the sun exposure for vitamin D. And dermatologists, of course, the advice is that you must have the sunblock. So
Yeah.
how do we manage this one?
Yes, I think that's always a controversy. But for vitamin D, I think even if you just have about 15 minutes of early morning sun exposure, or maybe even 15 minutes again in the evening would suffice. What is actually important is the 9 to 5 o'clock sun, which is what is going to cause more pigmentation. And like I mentioned, we as Indians are always more prone for pigmentation. So even if you can get your vitamin dose in sun exposure at not the peak hours, you can still manage to have a proper sun care routine or sun protection routine.
Right, and maybe expose not the face as much as the other parts.
Yes, I think
Agree.
that's a good idea. Yes.
Yeah, right. Another question for you, Dr. Sama. So there are so many anti-aging creams, under eye creams, which are exorbitantly priced. Few thousands for a 10 ml bottle. Do they really work, and is it worth spending that kind of money?
Yes, so actually, unfortunately, today almost all of our Indian pharmaceutical companies have several cosmeceutical divisions, and we have all range of products available in the market today. So you can actually pick up, especially I say this to patients with sunscreen. You don't have to pick up something that's really expensive because you have to use it liberally. So when we come to anti-aging, if you have a basic retinol-based cream, which is also not very expensive on the spectrum, you can still use it by the night. And for eye creams, also you have several combinations with hyaluronic and lightening agents. Another point, whether it helps you, uh, creams, anti-aging creams, I will compare to like a healthy diet. If you're going to keep eating healthy, similarly, if you're going to keep using creams, maybe 4 years, 5 years down the line, you're going to have healthier skin as opposed to having not done anything at all. But does it really reverse? It usually doesn't reverse. Probably it's more preventive.
Great. Yeah, thank you. Dr. Krupali, a question for you here. Which are the foods that stain the teeth the most?
Basically, you have a lot of medicines which stain the teeth. In food products, of course, tobacco, alcohol, fruits like pomegranate, even purple jamun, they tend to stain the teeth a lot. And also certain nutritional deficiencies, certain kind of fish tend to stain the teeth a lot. So a quick tip that I give all my, and also with the kind of spices that our Indian food has, staining does happen inevitably, and tea and coffee, so you cannot restrict. Nobody wants to miss their tea and coffee. So what I actually suggest to all my patients is just gargle. You can't, I can't expect them to brush all the time, but just gargle after everything you eat. Just nicely gargle so that everything is, off your teeth. So that will prevent staining. And having said that, like every 6 months, cleanup is mandatory for everyone to maintain good health.
Right. So even after you've had the foods, if you gargle, you are kind of minimizing
Yes.
the staining.
Yes.
Okay. And which foods do you think are particularly teeth friendly?
Kid friendly.
No, for the teeth.
For the teeth. For
Yeah.
teeth friendly. Anything without sugar and anything that is not sticky. To be very honest, I do not deprive my patients, especially the kids. I do not tell them don't have candies and don't have chocolates, because I feel if they don't have, then who will have? So I actually inculcate the right technique of brushing, and I eat everything. There are even times when I even have pan, to be very honest. So I think if you're brushing right, you can eat everything, you can enjoy everything. But if you're not brushing right, if you're not following up with your dentist, then yes, avoid sticky things and avoid sweet stuff for sure. So eclair, popcorn, and all your candies and lollipops and whatever, anything with sweet. Yeah.
Right. Thank you. Another question for Ruchi. So any grooming tips at the dinner table, since we deal with food all
As
the time?
as a women, you need to make and ensure that everybody is eating nutritious. Who knows it better than you all? But yes, for the dinner table, ensure that you're chewing the food very, very well. Also, that is also a grooming tip, because that makes sure that, like whatever is in your plate, it's not spilled all over the plate. The maximum, like flaw, what I feel Indian people do is the plates are always spilled. So when you're pouring, take a small portion, which will help. But at the same time, make sure when you're lifting your spoon also, pick up a small portion so that the plate looks neat and clean till the end.
Great. Um, this one is for Sumita. So a lot of our patients or clients, when they come to the clinic and we are talking, they're taking their dietary recall, they say, I have a yoga session and my yoga teacher has told me not to eat for 4 hours before the class. How true is it, and what is your take on this?
Can you explain me again?
So a lot of people who undertake yoga, they say that they do not eat for at least 4 hours before a yoga class. So is that important, and what do you think of it? Is it it has it to be 4 hours? It can be less. What is your view on this?
Yeah, actually not 4 hours and all. Actually, see, the schedule is like, morning yoga is always best. And if you're doing for the weight loss, so empty stomach, that means you can just have like one small banana and all, and then you're doing the exercises. That's good for the weight loss. Okay, that depends. Okay, why you're doing yoga? You're just doing for the fitness, then you can do like a morning, you after then evening session after your eatings and all. That's fine. But the important thing is the most of the asanas you can't do with a full of stomach. But if you're eating just little portion, like one banana, yeah, small snacks and all, so that is fine. But that again, the important thing is if you're doing the standing practices, that is again fine. But if you're doing the lying practices and lie down on a stomach practices, so that is like very difficult. So which kind of the workout you're doing, that is again very important. Then which kind of the prakriti you have, that is if you're suffering from the acidity issues and all, and if you're eating like little bit only and then you're going to do the yoga practices, that is again the very harmful. So इसलिए that is the like a that there is a rule कि at least you have to maintain the 1 hour gap between your yoga practices and your any kind of the meal. But after lunch and dinner, there are no practices. Then only you can do the normal walk and all. And then there is only one practice you can do with a full stomach. That is the Vajrasana. That is the only asana you can perform after your any meal full of stomach. Other there are no any exercises particularly after your meal.
Okay, thank you. And any particular asanas that you would suggest for skin and hair?
Yes, actually, there are the like the practices which are like a head down and legs up postures. Basically, like a Shirshasana, that is the head standing. Sarvangasana is again amazing practice, and especially those practices which are work on a hormonal issues, hormonal, that is the endocrine system. Like Halasana is again amazing practices. Then for skin, there are specially I already explained in my speech, that is the Kapalbhati. Kapalbhati and Bhasrika is again. Both the practices like amazing for the skin, because I already told you that impurity is removed by this Kapalbhati practices and Bhasrika practices. So I think that this practices and then asanas which actually like the posture are head is down and then legs are upper side, so blood circulation is improved towards your head. So that practices are actually specially for the hair loss problem, and pranayam is good for the skin problem.
Great, thank you. Thank you very much. Another question from Dr. Sama from the audience. I know it could be a whole chapter, but they're asking what are the causes of whitehead, blackhead, prevention and remedy?
Okay, so whiteheads and blackheads, or if we have even the red pimples, are actually all different stages of evolution of acne or pimples. Now, of course, we do see a lot of adult acne, and like you rightly said, it could be a huge chapter, but I'll try to make it very precise. There's irregular keratinization, there's irregular skin formation, which tends to block your pores, and then they become as blackheads. Because of that, there's a back pressure, the oil gland swells up, and then you get the more inflammatory ones, which are the whiteheads or the big red angry ones. At the end of the day, what we really aim at is using to regularize the keratinization. So keratolytics like adapalene or retinol-based molecules, which when used over about 2 to 3 months, will make your skin form in a more regular fashion, and they will prevent the blackheads and the whiteheads from forming. So that would, I think, be the mainstay. Of course, we have clinic treatments like chemical peels and stuff, which we do. But what's most important is to do your 3 month of treatment, even if it's your keratolytic creams, and then maintain it by bedtime by using a keratolytic, because most people who break out always have an underlying cause. It could be hormonal or maybe comedogenic products, which also need to be eliminated.
Great. Another question for Dr. Vibha. So any contraindications for use of, mega doses of biotin? Biotin has become so popular for hair. It's kind of synonymous with hair fall or anything that has to do with hair.
Correct.
So
I don't really think there would be any side effect, but obviously like we would use a particular dosage And the normal formulations have up to like 10 milligrams. I think that should be good, maybe up to we going twice a day also.
I see. Right.
And then we need an all-round, as we said, it's not only one nutrient that we would require. We would give like an all-round. These days, you get even the cyclical therapy kits, which have everything in them. So that kind of helps because you really can't pinpoint which nutrient is that would be causing your hair fall.
Right. So that was my next question, that the cyclical therapy, you think it has a rationale and it is useful
It
instead of
definitely, yes.
popping the same multivitamin every day.
Correct.
Cyclical therapy has a
Absolutely. So when the patient, like they say, they first come to you, and even if they have not been on any sort of, say, nutritional advice, or they have not been taking any other supplements, usually they have like, some amount of like a broad spectrum deficiency, some part of this, some part of this. So a lot of people benefit just with 3 to 4 months of cyclical therapy also. Like I always, we club in a lot of everything, like we'll club in some medical therapy or some procedural treatment, but there are some people who are insistent that no, we only want medicines, so they do very well with this, with the cyclical therapies.
right. Rashika, talking about multivitamins and vitamins and biotin, what is actually the RDA for vitamin? Do we have the Indian RDAs, or do we rely on US RDA, or now the new IFCT has some details?
Yeah, I think it is around 30 mcg per person per day.
Okay. And we were talking about, again, vitamin D. So there's a subset of population which refuses to take non-vegetarian source of vitamin D, capsule which has a non-vegetarian source. So are there any vegetarian sources of vitamin D?
You mean food sources? Food sources
Yes,
are not
yes.
there unless the foods are fortified. Vitamin D food sources are not there, either in supplementation form, or then you'll have to have fortified milk or bread.
Right.
Yeah.
Okay, yeah.
So vitamin
For
D
us,
is your
it has
sunshine
become
vitamin.
yes. Yeah. Another question, I think this would be the last couple of them. Somebody is asking the use of take on niacinamide serums. Dr. Sama, if you want to take that.
Uh, I think they're talking about applications, right?
Yes,
Uh,
please.
yeah, so I wouldn't.
Serums.
Yeah, so niacinamide actually has a very good anti-inflammatory role. In fact, I do prefer niacinamide and clindamycin combinations for the acne eruptions. There are much better serums or more appropriate serums if you're trying to use it for a lightening serum per se. Then you'd rather opt for like a vitamin C serum, which would probably be beneficial in topical applications.
And last question, cause of Melia and the remedy.
So Melia is basically where your skin is collecting and it does not exfoliate in a routine manner. And some people have to have this tendency of getting Melia recurrently. Sometimes it could be because you're doing facials or cleanups, so they're trying to dig into your skin and they could be post-traumatic. Unfortunately, there are not much topical applications you can use at home for Melia, except for maybe a retinoic acid. But a lot of times people get Melia around the eye where you do not want to use a retinoic acid-based product. However, the removal for Melia is very simple. It's a very small procedure. It's a clinic-based procedure where numbing cream is applied and the RF ablation is done. And usually people need to do just once a year. So if it's very obvious, that would be the ideal treatment.
Great. Thank you very much, all the panelists. I think for the want of time, we will have to kind of bring this to a close. So I would sincerely like to thank all our speakers, okay, for again, a beautiful session inside out, Dr. Vibha, Dr. Sama, Dr. Krupali, and of course our grooming expert and Sumita. I would also like to thank Rashika Chunawala, who's the convener of this program, for putting the whole program together. And a big thank you to the Breach Candy dietitians, Rashika's team, especially Mispa, Pooja, and Gwen for all the technical support, without which perhaps this would not have been possible. I would like to thank our national president, Dr. Madan, for being ever so encouraging. As I said, last minute because of certain reasons she could not join in. I would like to place on record thanks to our convener IDA Mumbai chapter Zamrud Patel for supporting all the new ideas that we come up with. And a big thank you to our technical troubleshooters, Kasturi, Prachi. We actually reached out to them last night at 11 p.m. Because we were having some hitches with the presentations, and they were ever so ready. So thank you once again. Sukhada, in fact, joined in this evening also to help out. A sincere thank you to the audience for their active participation and for their patient hearing. So this is Neeti Desai on behalf of IDA Mumbai chapter.
Thank you, Neeti.
Signing out.
She's been my co-convener. She's been throughout along with me for the journey, and I've been just eating her brains up for something or the other. I mean, Neeti, can I do this? Neeti, can I do that? Can we do this? And it's been a roller coaster ride, but it's been a beautiful ride. Thank you so very much. And a sincere thank to all my speakers who just by one message agreed to do this program.
Right. No, it has been absolutely enjoyable, and I think it's been a great session. Thank you once again, everybody, and have a good evening.
Thank you, Rashika and Neeti, for a wonderful and beautiful session.
Thank you.
Thank you, Zamrud. Thank you. Right. We sign out?
Yes, we sign.
Yeah. Thank you so much.
Thank you so much.
Thank you,
Thank
everyone.
you, all the speakers. Thank you.
Thank you.